Welcome back to Untold Physio Stories podcast. I'm your host, Dr. E, with Modern Manual Therapy and Edge Mobility System. And of course, Untold Physio Stories is your podcast with big physio failures, interesting stories and cases and research updates, and cool stories from interesting PTs around the world. So today with me, I have Dr. Caroline Adrian. And how's it going today, Carrie?
Wonderful, Dr. E. I appreciate this opportunity. Thank you for having me.
Yeah, welcome. You're welcome. So on LinkedIn, I saw that she had mentioned something. It was an interesting story about how you got a season desist, right?
Sure
So
did.
first, actually, let's just talk about. Let's just do a quick intro, and you can talk about your story, and then we'll talk about the other thing I'm interested in.
Love it. Love it. Gosh, where to start? Urson, the February 7th was 25 years for me in this field of veterinary physical therapy. I met my former boss. Did you ever watch Animal Planet Emergency Vets? Did you
No,
ever
but
see
I used
that
to watch
show on
Animal
Animal
Planet all the
Planet?
time. Like I loved, yeah. Back when I had
Yes.
cable, back in the
Yeah.
day, I
So
used to love Animal Planet.
yeah, that was where I started at Alameda East Veterinary Hospital in Denver, Colorado. Met my former boss, Bob Taylor, there, and he offered me a position. I was right out of PT school. I graduated in the spring of 1999, passed my licensure exam, and he offered me a position later that fall. And I moved in February, started February 7th of 2000.
So in Colorado?
Yeah, in Colorado. I moved from Pennsylvania to Colorado, got my PT license in Georgia. So I'm in active PT, Georgia, Pennsylvania, and offered me a position at Alameda East as a full-time veterinary, physical therapist. And that was 25
Wow,
years
that
ago
that
now.
is that's progressive. I mean, in New York, we still can't
That's
only
correct.
vets or vet assistants or techs. I don't know what they're exactly called. Only
Yeah,
they can do physical therapy on animals or dogs or canine physical therapy. So,
unfortunately.
but
Yeah.
let's talk about the cease and desist. What happened?
Yeah, so I was not far into my career. Like I said, new graduate, got a letter from the Veterinary Board, cease and desist. You are practicing veterinary medicine. So, as you can imagine, it was quite terrifying, not really, understanding where I fit in, to be honest. I wasn't a veterinary technician, although I did practice as a veterinary assistant for years in Pennsylvania and in North Carolina. Was
So hold
not a
on a second.
registered.
What is the because for us, tech and assistant are two different things. For
I
physical
thought so
therapists.
too. Yeah,
So
I thought
so
so too.
so is it flipped then for
Mm-mm.
vets?
So a veterinary technician is a registration now or certification. So you're either an RVT or a CVT, and you go through. Typically, I believe there are 2 year, year and a half to 2 year associate's degrees. Whereas a veterinary assistant, essentially, you can walk off the street, be trained to work under a vet tech or a veterinarian as an assistant.
Okay, so their assistant is
Different
our
than
aid
PTA.
and
Yes, is our aide.
aid
That's correct.
aid, right? And
That's
then
correct.
yes, okay, that's what it
Yeah,
made. All right,
veterinarian, vet tech, and then a veterinary aide is similar to the PT, the PTA, and the PT aide.
okay. So you
Correct.
practicing previously as an assistant actually means nothing. At
Exactly.
that
That's exactly right. I worked
yeah,
in vet hospitals. I scooped a lot of poop in my career, Urson.
yeah, right. Yes, yes,
Yes.
yes.
So I practiced as an aide, and I didn't really understand. I was running anesthesia. I was, doing X-rays. I was doing a lot of that. That was over 25 years ago, and the profession has come a long way since. But it was absolutely terrifying. As a new graduate, I just spent a lot of time and effort going through, a 3 year Master of Science in Physical Therapy at North Georgia in Dahlonega, Georgia. Just passed my board exam, and I'm not far into my career, and here's this letter from the vet board. So in hindsight, there's a lot of things that I would have done different. It was okay. The practice of physical therapy in Colorado was defined on human beings. We treat human beings. So I was unable to call myself a physical therapist. And then secondly, it was the new age of websites, and everybody has their information up on a website. Well, I didn't really fit in anywhere. And they had me listed under, veterinarians on the website. And I'm not a veterinarian. So it was the perfect storm, if you will, of all of these things that had gone wrong, to receive this cease and desist letter. So as you can imagine, it was very terrifying. My boss was wonderful. We approached the vet board at that point, and we approached the PT board, and all I did was take out a comma. So my credentials was MS, comma PT, which was my license. Right, my degree was a master's, my license was a PT. If I just took out that comma and went by my whole degree was an MSPT, then I could practice in that gray area. Yeah. And that was 25 years ago, Urson.
Yeah,
So
I mean,
crazy.
yeah, I feel like that just wouldn't fly in New York. I mean, I don't know.
Yeah,
I'm no lawyer, but that's
you're
like,
probably right. Yeah. And there
yeah,
are
I can
some
see the
states,
distinction though, because MSPT is the degree. So
correct.
so you're just saying you have a degree as
In-
because at the time you also were practicing on humans, which is funny too. It's like, does it not make you a physical therapist? It's not like you weren't a licensed physical therapist, right? So
exactly.
yeah,
Exactly.
yeah.
Yeah, and you're right. There are several states. I think Ohio, New York is definitely one where the practice of physical therapy is for veterinarians and veterinary technicians only. Unfortunately, there's a lot of states that are gray. I think we have maybe 4 states now that actually have language for physical therapists to practice on animals, and one is Colorado. We'll go into that in a minute, but Nevada, New Hampshire, and Nebraska.
Okay.
So we changed it. We changed our practice act. Initially, the physical therapy board didn't want to deal with us. To be perfectly honest, hey, you're treating animals. You should go talk to the vet board. And all kudos, all credit to Deanna Rogers, who's a colleague of mine and another physical therapist who initiated this discussion with our Colorado Veterinary Medical Association. They were wonderful. At first it was, who are you and what do you know, right? It's all part of that educational process. That's still going on. They don't necessarily understand the level, the depth and the breadth of knowledge that we have. Now I didn't, but physical therapists are all coming out now with their doctorate, which is the academic equivalent of a DBM. So you have that DPT and that DVM academic equivalent, but think about, the DVMs aren't necessarily used to referring to an outside source, and they're used to referring to
Right.
the
Who are they going to
technician,
refer to?
the aide.
Some sort of dog pediatrician or dog orthopedic surgeon
Right,
or dog.
right.
Did they just do everything, right?
They do.
Is it like all in one specialties?
General practice, does a lot of that, but it has
Yeah.
come a long way as well. Where I worked my entire career in a specialty veterinary hospital, so we had specialties like neurology, like orthopedics, radiology, internal medicine, oncology. We had all of those specialties, which is another step up, and that's who I learned with. It was a wonderful collaborative effort. So we had to go back to the vet board, educate them on our depth of knowledge. We know this information. We understand when to refer. We're used to working with other licensed professionals. Veterinarians are not.
Hmm.
So it was an education first and foremost, and that was the most important. And getting them to understand who we are and what we know. And then from there, they wanted us to be legislated under them as a veterinary board, and that's when the PT board stepped in and say, hey, these are our people, let's legislate under the physical therapy board with the blessing of the vet board. And that's how we did it. All credit
Wow.
again to Deanna. It took us 4 years.
And how many of you are doing this?
I don't have a number, Urson, but we are all over the country. I was,
I mean, like in Colorado.
oh gosh, I would have to count up and down the Front Range. Um, God, I don't
But
even
at the
have
time
numbers.
during all the legislation, wasn't it just a handful or no?
Well, and that's my little claim to fame is the first physical therapist full time in a private veterinary hospital in the
That's
country.
what I'm
So
saying.
yeah, that was
That's what I'm
it.
surprised. Like you got these two boards, state boards. I mean, it's hard to even like contact our board. I
Right.
when I graduated 27 years ago, the same person who I still think is at least a year or two ago, who used to run the PT board. Last time I looked, maybe like 5 years ago, she wasn't only running the PT board, she's running like 10 other, in New York State. It's like the same whatever bureaucrat or something, and
You have to love it.
you
Yeah,
can
you have
never
to
get a
love it.
hold of them. You know what I mean? Like you can't if you email them, it tells you to call. If you call them, it tells you to email them. And if you email them, it says, "Hey, try faxing," or it's some ridiculous loop, right? And I'm like, and
Yeah.
meanwhile, you and maybe one or two other people got two boards to talk, and I just can't. This is, like, frankly, an unbelievable story,
All
actually.
credit to
Uh,
Deanna Rogers. She
yeah,
was
yeah,
amazing. And you
yeah,
show up, right? And it's the
right.
face to face that's the most important. It's
Hmm.
it's one thing, doing this, and emailing but pick up the phone, attend the board meetings, be present and educate. And that's what I think really helped. And then to define it, in 2019, we defined the practice standards for animal physical therapy, canine mostly, and equine, and we published that. So we're taking steps towards the educational aspects of it all, and making sure that you're competent. It's like no. It's just like any other, geriatric or specialty. You have neuro, you have ortho, you have geriatric, sports medicine. We see it all. So we don't differentiate. We see the geriatric dog patient, the cat, the random cat. I've seen. I worked with a tiger. Had nutritional deficits. It was sedated. Worked with a flamingo. I did some pro bono stuff from the Denver Zoo. I had a little ferret. I had a wallaby. So and it was we had a demyelinating disease from an orangutan at the Denver Zoo. So, it's a crash course in anatomy. It's still bones, muscles, tendons, ligaments. It's been an amazing career.
Yeah, that's crazy. I mean, like I said, 20 something years ago, when I thought, hey, this is before I became a cash-based PT.
Yeah.
But people pay whatever for their dogs, and
Mhm.
meanwhile they don't want to pay their $20 copay, right? So I was like,
That's
oh,
right.
maybe I'll just. Oh, I saw that the local vet place had canine PT, and then I just looked at, and I found a program not as comprehensive as yours, but it's more like a sort of certificate program, and I thought, oh, I'm going to do this, and I just look at the State Practice Act, and they're like, no.
Yeah. Unfortunately, New York is one of those tough ones. But we need some boots on the ground there, Urson. So let me know when you're ready. Okay.
I'm not. I'm not doing
I'll
this.
get you a
I'm just
model.
gonna
We'll
hang
work
out.
something
I'll
out.
just hang out with my dogs if it's all the
Love
same to you. Yeah,
it. Love it. Yeah.
yeah, yeah. But I mean, I appreciate that, and that's great. And if people want to hear more about your program, because obviously, I think a lot of us are caring individuals, and I find a lot of PTs are animal lovers as well. So if you want to combine both of these passions into one thing, how can they do that, Carrie?
Yeah, I appreciate that. I started Canine IQ out of a passion project. This is not retirement plan for me. This is me being able to give back to my profession and the mentors that I've had over the years. So if you go to Canine IQ, it's CANINE IQ.net. You can read all about our transitional CPT program. So it's kind of a spoof on the transitional DPT, right? For those of us, old dogs, if you will, that didn't have an opportunity to get the doctorate.
Yeah,
We have the transitional program. So that's what I did, taking our knowledge and base, filling in those gaps of what you need to learn as a PT to competently treat your canine or small animal patients.
yeah. And then you can have your own built-in cash. You have an automatic cash-based
Exactly.
practice with people who are actually willing to shell out whatever,
Yeah,
right?
well, and it's a great model. There's a lot of PTs out there doing half and half, right? They still want their hands on humans, and they're doing part time, small animal. It's wonderful. I personally
Yeah.
will never go back
Imagine
to.
if all your patients were cute. That could be a great tagline.
Well, and you get kissed all day, right? And nobody calls
Yeah.
HR, and you just get kissed.
It's not a bad thing, right? My
Right.
wife wouldn't be jealous.
That's exactly
She might
right.
tell me to take a shower, but yeah.
Yeah, I did that. Yeah, yeah, you get furry. There's no doubt.
Yeah, yeah.
It's been a very rewarding career. Very very grateful.
Well, that's
Still a
great. I
passion.
mean, Yeah, I've had a couple seasons assists basically because I teach the eclectic approach, and the
Mm,
whole thing is I'll take some Mulligan stuff, I'll take some Mackenzie stuff, I'll take whatever, all these gurus, right?
right.
And on my birthday, which is actually February 6th, so it was the day before you got your season assist, I actually got a letter from, it was either Mulligan or Mackenzie Institute, because I got a similar letter a week later, and I thought, oh hey, is it Mulligan Institute or Mackenzie Institute wishing me a happy birthday, and it was a season assist.
Nice try. Yeah,
Mm-hmm,
you'd
mm-hmm.
like to
Yeah,
think, right? You'd
yeah. It
like to
was
think.
not I mean, I didn't think I was that special to be on their radar, but I was special enough to. It was basically I just had to stop using the terminology in my slides.
Oh, interesting. Yeah. I
Yeah,
mean,
because
easy
they're
enough.
trademark terms, and
Sure.
so I could teach, because you can use that all day in a PT school, but you can't if you're teaching a course for profit that's not, and you're not their faculty, you can't use their trademark terms.
Oh, that's interesting. Yeah,
And I was like, what
that's
about my hundreds of YouTube videos that use the terms? They're like, yeah, okay, you don't have to do that. And
oh,
at the
that was nice.
time, I was one of the first YouTubers who were, like, oh, here's a McKenzie technique, whatever. Now I think it's too prolific to actually go after all these people, right?
Right.
But I was
But
I was one of the first.
I would think they would want us to be adapting, their techniques to animal patients, which is what we do every day. So it's,
Yeah, why
you
not? Repeated end range. I mean, I have
you
people,
bet.
I developed like ISTM tools like this. That's also what put me on the map. And I have a lot
Absolutely.
of I have a lot of massage therapists who use them on horses. So,
Yeah. And
uh,
it's no different in dogs, Urson.
yeah.
Absolutely not. We do a lot of IASTM on dogs. We'll talk. We'll have to talk about that.
All right, great, great. Yeah, yeah. Um, that my one question. It was either to. I've always wondered. For me, it's all about the compliance, and it's all about the program, and it's developing a therapeutic alliance, and it's like, how do you even get a dog to do a program, or how do you even know what their complaint? Because if it's pain, I mean, they're limping and stuff, right? And
Oh
and
yeah.
how do you even
You,
how do you
you
even know? I
you'll
mean,
know. I promise you. When you get snapped at on multiple occasions, you will
oh
know
no, but I
that.
mean, like, how do you know? What, it's like we do something like, oh, does this hurt? Yes, this hurts. Does
Yes.
this not hurt? I guess, yeah, if you get snapped at, you're palpating, but I mean,
But
it's not like you
but
can just
that's
do a
part of
movement screen or a special
yeah.
test or,
Yes, absolutely. We have special tests for hip, for stifle, for
yeah,
shoulder, for elbow, all of the above.
yeah,
And that is part of our program for the Canine IQ is understanding behavior and
hmm,
understanding when that what that animal is telling you. And is that pain? Is that fear? All of the above. You can get hurt. I've been knock on wood. I've been bitten one time. It was actually a show dog, believe it or not, that I was treating for a biceps tendonitis. Right? Go figure. So we you have to learn behavior. You have to understand handling, and being able to get that animal to trust you to do what you need to do because we are all hands on. Like you said, there's no verbalization. We talk to the
yeah.
client, sure, but you've got to be pretty in tune with your patient to understand what they're feeling and put your hands on them,
Hmm.
palpate.
It's a whole new realm of therapeutic alliance. I've been bit once before too, but by a TMJ patient,
Oh
because
no.
because she was referred by a doctor who apparently did some sort of masseter manual muscle testing, and he used to wear like these thimbles and say like bite down as hard as you can, and I'm like, well, I don't know what information that gives you, so I just said bite down lightly because I'm just checking her occlusion or something, and she just heard bite down and
Oh
not the
no.
lightly.
See,
I was like,
it's
whoa,
a yeah,
it's my
it's a job issue, and no matter where you are, no matter
yeah,
what the species, yeah, there's
right.
there's issues.
I guess
That's
that's a job risk they don't tell you about in school.
yeah,
Yeah.
no,
All right. Well,
that
hey,
is
thanks for
not
coming
something.
on.
My
If
pleasure.
you
Thanks
if
for
you guys are
having me.
interested, if you guys love animals and you're looking for a whole new or maybe even a side gig or something, it sounds like Carrie's got a great program. It's caniniq.net, and that will be in the show
Net.
notes as well. All
Yeah,
right.
check it
So,
out. And if you have
as
any
always, you
questions, please
guys,
feel free to contact. Thank
yeah,
you.
for sure. She's also on LinkedIn. So, um, if you guys like this story, or if you guys have any interesting physio failures of your own, or interesting cases or stories, feel free to message me on Instagram, Facebook, LinkedIn, YouTube, because we cross post everywhere. Also, rate Untold Physio Stories. It goes for you too, Carrie. Rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially Spotify and Apple, as that helps our discoverability. And you guys have a great day.
Love it. Thank you.